Hey y'all, hey, and welcome back to the channel. Welcome back to the chocolate spot where everything is always sweet. So, of course, I needed to update you all, or you probably heard me on some of my videos that, well, first of all, y'all, sorry. Hello. How are you doing today? If you're new here, welcome to the channel. If you're old here, thank you so much for my support and my 8,000 followers. Thank you. I thank you. So, I'm pretty open and about a lot of things, open book. So I had been talking to you all, but not indirectly about my knee treatments. So I had been, I have bone on bone knees, plus I have arthritis. So it took me, I did the interview with my doctor probably about 3 weeks ago, but I ended up sick, and I'm sure you all know from a couple of other hauls that I did. So I didn't want to be trying to sit in front of a camera sick, and I have to edit that in. So I wanted to wait till I felt better. Well, I'm not completely sounding like a frog or whatever, but I wanted to tell you all about the treatment and show you the treatment because he allowed me to film it as he did the treatment, and he did an interview to tell you a little bit more about pricing and all of that. So I wanted to do this intro so that before I show you the video of him doing the treatment and his part, I wanted to tell you that my honest review on it. So altogether, I had 9 treatments. The first treatment was on sale, so it was like $69 to try it. So I paid the $69 to try it. He told me about, the pricing. He told me about explain the treatment. So initially when I went for the treatment, I thought, okay, this is just to trying to stop some of the pain. I wasn't thinking, okay, my movements was going to change or I was going to be able to run no 5K. I just wanted to not wake up in pain, go to sleep in pain, and work 10, 13 hours sometime in pain all day and constantly popping pain pills. So, and a lot of times I would just like fight through the pain because I don't want to be taking all of these pain pills. So I would just like fight through the pain and get what I got to be done. Then my daughter brought this ginger rub from Charles. I can't remember his last name right now, but I'll put it on the screen. And the ginger, prior to that, I was using a LeVee spray, and it was working. It was relieving it. I'll be able to get at least through 5-6 hours of the day where I'm not in pain. But if it's going to be a storm or rain, I'm going to be in pain regardless. So I was kind of mixing those two things up or whatever. So when it kept coming across my Instagram feed, kept coming up. And then, once you hit on something, it just always throw it in your face then. So bottom line is I seen it. I'm like, oh, it's not far from my job. So I'll try it. I went the first treatment, he did it. And when I stood up, he was like, so how do your knee feel? Now, my right knee is not as bad as my left knee. It's weird because my right knee is the knee I had the surgery on. But by me compensating for the right knee with the left knee is in worse condition. So I'm like, I really didn't have no high hopes, but I'm like, maybe it had me out of pain for at least a week. So I'm like, okay. So he do the treatment. I get up, and he's like, okay, so what are you feeling? So I'm looking at him like I wasn't expecting no instant gratification. So I was like, oh, well, now that you said something, I don't really feel nothing in my left knee. My right knee a little sore. He told me lay back down. He did a little bit more. He also on the dial tell you where you starting off. I think the highest is 12, from 1 to 12. So he explained to me what he was using or whatever. So I laid back down. He did it again. So I felt it was good that day, that rest of that week, because for the first time you got to come twice a week for I think 2 or 3 weeks, and then you to once a week. So it's 8 treatments altogether. So I spent $1,800 and it was well worth it. I'm here to tell you that I don't wake up in pain. I don't go to bed in pain. Like this week in Chicago, it has been raining. Like it's damp today. It's been wet all week. Except for Monday, it was like damn near 80 degrees, which is weird because it's October. But all week I have not been in any pain. I haven't had any problems, and that's not what would have been happening. So he says after 4 treatments, you will feel the difference and you'll be able to see a difference. And I want to say after my second treatment, I was a little worried because after the second treatment, I was in so much pain. Again, there was a wet week, with storms and all of that was going on. So I kind of was like taking a chance. I'm like, oh, I shouldn't even go back because I'm wasting my money. But something told me, just keep going. So I went and I kept going. And I'm telling you right now to today, like I said, it's wet this week. I haven't felt nothing but a little tingle in my left knee, which is to be expected. Again, I still have arthritis. I'm not going to even try to butcher and tell you what these treatments do, tell you about the stem cells and not, because he's going to explain it in all of in the interview that I'm going to edit, put in here. So he's going to explain to you everything about the treatment, the pricing, how many times a week you got to go. I'm only telling you on my experience. My experience with Dr. Mark and this treatment has been, I want to say, 95% successful rate for me, because I'm telling you that I don't wake up in pain. I don't go to sleep in pain. I'm not in pain every day. That was my major concern. But most of all, my movements, I'm able to do stairs a lot easier. I'm able to get up and move around easier, faster, or whatever. It has been a success for me. How long is it gonna last? I don't know. He told me that as the stem cells move and grow and attach, that it's just gonna get better and better. If it's gonna get better than this, listen, I'm gonna say this. We jag off money going out to eat. We jag off money on designer stuff. We jag off money on just shopping in general. That really brings us no extra value to our life at all. To be honest, none. But we will save to go on vacation. We will save for a bag. We will save for all types of stuff. So I started to save for this and make it a priority so that I would have a little bit more, a better lifestyle, better longevity to being able to do things and get out and do things. So I'm going to say that I feel like it's a 90%, 95% success. But what I'm asking is that, if you all are willing to try it, I would say try it. I would recommend it. And the doctor is going to explain a lot more. And I will attach it to this. And then I'll be back with you all.
All right, you ready?
Yeah.
Okay. Here we go.
So, do you think that this actually affects in a positive way the arthritis?
It does, yeah.
Yeah, because...
So it turns off the inflammatory process that's creating the pain with the arthritis. Mm-hmm. And then it has the ability to actually try to repair some of that tissue in there. So when the stem cells and growth factors and all that arrive to the knee, they'll start repairing what it can. So it'll help kind of rebuild some of the cartilage back in the knee.
Okay.
Calm down the inflammation that's causing the pain.
And I had started back using the LeVee cream for pain, but not often. I haven't had to use it often.
Good.
And I didn't put on any today. Just on my hip.
Is that tender right here?
I can feel it, but it's not
not
tender like we started at.
And we are 2 levels higher than we used to do.
Okay.
So that's a good sign. That means tissue's been changing, inflammation's down, so you're not feeling it as much.
Yeah. And then how long do it take before people see full results?
So the full end results are up to 12 weeks from the first treatment.
Okay.
So yeah, once we do all 8 treatments within the 6 weeks, then you have another additional 6 weeks. I sometimes explain it like this: like, think of it like getting an injection and being told it's going to take up to 12 weeks for it to take full effect.
Okay.
Even though we're done treating after 6 weeks.
Okay.
And I get the phone call all the time from people at that 12-week mark that call me up to tell me how much better they've been doing since I last saw them.
Well, yeah, mine has been much better, and I'm not now. It's real tender right there.
Yeah. You still get any trouble going upstairs?
No, not as bad. I mean, of course, I got arthritis, so I'm always gonna have some tenderness, but no. So for everybody, do you recommend the 8 services?
Generally, yeah. If we're dealing with something like that's more of a chronic issue, yeah. I want to do the full 8 because that's what the studies show to get the full amount of stem cells there.
Okay.
Now, if someone comes in with like a little, they tweak their neck or something.
Okay.
That's soft tissue. 1 or 2 treatments, they'll be fine.
And this procedure could be did for several different pain.
Yeah, I can use this on almost any part of the body.
Okay. And tell me the name of it, and because it's not covered by most insurance.
No. Sure, no insurance right now covers this treatment. This one is considered experimental still.
Okay.
Still in the same world as like PRP injections and stem cell injections.
Right.
They all deem it as experimental. Even though there's mountains of research on it.
Yeah, I am a witness that it works. I told you I talked to someone that told me that they doctor said it wasn't going to work and it was a waste of money, but
I hear that a lot.
I'm saying that I don't feel like I wasted my money. I actually have not been in pain for months, for a month or so.
I have a handful of people that have told me that same thing from their surgeons or doctors or orthos, and then they just go through it anyway, and then they go back to them and tell them it did work.
Yeah.
Just had that with the lady with the big, really bad plantar fasciitis from a huge heel spur. And her podiatrist told her, "Don't bother, it won't work." And she came in bouncing in all excited that she had no more pain.
Yeah, the pain is definitely minimized to almost zero for me, and I was waking up in pain.
Yeah, that's the worst when you're waking up at night with it.
Yeah. What's the highest level that this could come up to?
So I rarely ever go past a level 12 when I treat. It's usually the highest we go. The device can go up to a level 16. But honestly, you'd need some sort of anesthesia or some local anesthesia to tolerate that. It'd be incredibly painful. The research has also shown that once you kind of get past this level 10, level 12, there's not a significant difference in outcomes after that. It just burns through the applicator.
Because what did I start at?
We started at a 10. Probably started you with 8 and worked you up to a 10 in the first one. And we treated at a level 10 throughout the whole series. And now we got you up a little higher.
Yeah, because I want to say that I seen results after the 3rd time where I felt like the pain was very, very little. And then in the right knee, it was almost immediate.
Right.
But of course, my left knee is worse.
Generally, it takes up to like 3 to 4 treatments for it to start like sustaining. So like you do 1 treatment or 2, pain's likely to come back in a few days. Once we string together a handful of them, that's when we'll start to notice that it lasts in between the sessions. And that's when we cut down to the once a week part once they're doing better.
Okay.
Yeah, doing 1 treatment generally will last about 24 to 48 hours before the body wants to send all the inflammation right back to where it was.
Because you said this could be treatment for migraines as well.
They use this on, it depends on what's causing the migraine,
Okay.
If it's musculoskeletal related, things going on with the neck and muscles back there, then I can definitely help with that.
And I'm sure people want to know how painful it is. Like now, when it first started, I want to say I was at a level 9, 8, 9.
Yeah.
And now this is like a level 1. But this
Right.
also my last treatment.
And
so.
we're also on a higher level. And that's
Right.
exactly what I would expect to see.
Okay.
You've been gone for a little bit. The tissue's had time to heal, change in there. And now that we can, now that you're back here, because it's healthier, you can tolerate a higher level without all that pain. Yeah. That's always my goal throughout the plan, is to get them as high as we can.
And it's weird because this is my worst knee and I feel it, but it's tolerable. Like I said, it's like a 1-2.
Yeah.
And I can hardly take it on this knee at first. And it's storming. It's been raining for 2 days, and I normally will be popping all types of pain pills, in pain, not hardly able to walk. And literally yesterday and today, I got up, moved around like no pain.
Okay. All right, so this is the OrthoGold. This is by Shockwave, which is a German medical company. And so this is a type of shockwave device, and it's different in the way it's produced. So a lot of other shockwave devices that have been around for a long time, they're produced differently. It's a totally different type of shockwave. This one's produced in a water chamber with an electrode. It creates a loud pop. So what that does is it generates a heavy shock wave that goes into the tissue, eliminates the inflammation, and then it gets the body to trigger a biological response of recruiting its own stem cells and growth factors and white blood cells to migrate to the treatment area to start repairing and regenerating tissue. So the treatments generally, if we're dealing with like a chronic situation or people trying to avoid surgeries, especially like knee replacements, we have a lot of those people here. We do a total of 8 treatments. We do twice a week for 2 weeks in the beginning, and then we cut down to once a week for the remainder of the 4. And then when we're done with that, we have an additional 6 weeks of the healing and process still taking place. So they say in the research and the studies that have been done, it takes up to 12 weeks for the stem cells to fully migrate to the knee or wherever we treat, and then it starts repairing the tissue then. So I expect most people to be about 60-80% better once we get about 3 to 4 treatments in, and then they should continually get better after that. When we're done with our 8 treatments, we say goodbye for 6 weeks, and then we get back in touch, and we should expect to see that there's been nothing more but just more improvement throughout that, and that's been the case for a large majority of the people here.
And what are the prices of the treatment?
So the total care plan that I charge for is $1,800 for the 8 treatments. I do discount if they want to prepay for it in full. We'll take $300 off the top, and they can save $300 right away. So it'd be $1,500 for the whole care plan if it's paid in full. We can always throw in other treatments that we do as well. We can always manipulate. We can do soft tissue work, red light therapy. We use vibration plates, compression therapy, a few other things too that we throw into the mix, whatever the patient needs. And a lot of these treatments too, they're welcome to do it whenever they want.
Okay, you didn't tell us your name.
I'm Dr. Mark.
Okay, because I don't want to be like, yeah, Dr. Mark. And what is this location?
We're in Northfield. This is 1845 Oak Street in Northfield.
Okay, so
Right off the Edens.
I'm very happy with my results. So to finish up the video, y'all seen the treatment. You heard what Dr. Mark had to say. I personally feel like that it's a reasonable price because I paid $1,800 or $1,600 about 2 years ago, and it was a 2-day release of pain. And I personally think, and those were injections where it was a needle, painful, and I don't like needles, so whatever. So I want to say if I had to compare between the injections that I paid for and for the ultrasonic treatment, I'm gonna go with that one all day long, every day. Now, as he told you, this isn't just for knee pain; it's for any type of pain: back pain, knee pain, shoulder pain, ankle pain. So he didn't touch on it, but in the process, he did tell me that he almost that his ankle was badly injured, and he did it on himself. And with great results because he didn't think that he would be able to walk and do stuff, and he walks pretty good to me. But so I hope you all enjoyed the video. I hope that we see these infomercials and these things all the time on Instagram, little commercials and stuff or whatever on TV, but you're not really talking to the people that are actually using it actually getting the treatments, actually trying it. No side effects. So I'm going to go with try the treatment. He left you your information. I will leave his information down below if somebody want to contact him, especially if you're in Illinois. So if you want to contact him, if you want to he told you the name of the machine or whatever. I'm sure that other people are doing it in other states because it's a few people doing it here in Illinois. I just happened to go to Dr. Mark, and I'm very happy with him. And for further treatments or touch-up treatments, I will be going back. It's just as simple as that. It's like that $225 per treatment was well worth it for me. I can't speak for nobody else. So, what did you all think? Leave some comments below. If you're in pain, if you want to contact him, maybe he could give you referrals for other places in other states. I'm not sure. But here in Illinois, Dr. Mark is the man. He's been my doctor he was my doctor for the last 8 weeks. If I have to go back, that's who I would like to see. So, I hope you all liked it. Please like, subscribe, and do share. This is something definitely, all of my videos you should share. But this is something definitely you should share because I don't even do videos like this on my channel. But I felt like this is a part of my life. It's a part of my, this channel is for lifestyle, fashion, and this was a part of my lifestyle. This is what has helped me. So I wanted to share with my subscribers because a lot of you all are in Chicago or are in Illinois and may want to use it or know someone that need it. So until we talk again, here go a whole bunch of chocolate kisses. Disregard my nail.